For all inpatients, a thromboprophylaxis risk assessment needs to be completed. This is otherwise known as a TRA. This is what it looks like on EPMA. There are 3 steps. Step 1 is to assess essentially the mobility of the patient. So are they a surgical patient, or are they a medical patient expected to have reduced mobility, or are they a medical patient not expected to have a reduced mobility? For Judith Grinch, she's a medical patient who's expected to have reduced mobility. So this is the box that's ticked. Step 2 is essentially ascertaining any thrombosis or clotting risk factors. As you can see, there are quite a few risk factors outlined. In this case, we'll tick that she's over the age of 60 and that she has 1 or more significant medical comorbidities. Here, she has an infection. Finally, step 3 is whether the patient is at risk of bleeding. It's important to note that any bleeding risk trumps any thrombosis risk. So what that means is if the patient is at risk of bleeding, they will not get prophylactic heparin. In this case, Judith does not have any bleeding risk, so we don't need to tick any of the boxes there. The final step is our clinical decision that thromboprophylaxis is recommended. So we tick that box. And finally, we tick that the risk assessment is complete and save it. Next, we have to prescribe the dalteparin. So we add order and then write in dalteparin. The usual dose for patients over 50 kg in weight and whose EGFR is greater than 20 is 5,000 units. So we choose this and the information is already pre-filled. The frequency is usually once a day, given at 6 o'clock in the evening. To complete the prescription, we click OK.